Plain language in communicating health information. It is important to use plain language when communicating health information because it improves the patient-provider communication. When patients leave a clinic or hospital, they should be able to know what the problem is, what they need to do, and why that information is important to them and their health outcome. It increases competency and decreases risks of poor health outcomes. These are the 10 topics we'll cover today. Health literacy is a patient's ability to read, understand, and communicate health information. It varies by education level, age, race, and culture. Health literacy also impacts decisions based on the patient's understanding. Patients with low literacy results in poor health outcomes, and patients are often too embarrassed to admit lack of understanding. Even patients with high literacy are not guaranteed to have the best communication. In high-stress situations, they may be more focused on themselves or on their family, or have an increased trouble in processing information. Competency or understanding is important to decision making. To increase competency, speak slowly, use simple words, and talk about one topic at a time. Never assume a patient's competency. Just because a patient has high education levels does not mean they have high health competency. Medical terms are their own language. When assessing competency, it is important to encourage questions. You can teach them about their health or their healthcare plan, and then ask them to repeat back their understanding in the teach-back method. Any gaps that need to be filled can be bridged at that time. Health risks of poor communication result in medication errors, failure to follow through, less follow-ups, less use of preventative care, and increased hospitalization rates. Jargon, or shortened versions of a word or sayings, are difficult for the average patient to understand and can lead to miscommunication. Information should be broken down into small, understandable steps. Cultural barriers should be sensitively handled. A patient's culture influences their perception, preferences, and prioritization. A physician or provider should be willing to change the healthcare plan based on the patient's culture. Older adults tend to have a decreased ability of comprehension, cognition, vision, and hearing as they age. This results in a lower health literacy score. It is important to take extra time, use short and simple sentences, and their speech should be slow, clear, and loud to ensure competency.